to Healthy Lifestyle with Lorianne. I am Coach Lorianne, America's #1 take action success coach and strategist, empowering, educating, inspiring, and igniting people to take action with jet propulsion. If you'd like to get more information on that, please go to ldcstrategies.com. We have an easy 3-step system that is absolutely guaranteed to work for you. We really assist people to find and embrace their life purpose, really live to their highest vision, and get to where they want to be. Anyway, with that said, today I'm so excited. I have Tiffany Roggia here with me. She is from ACN, which is an alternative health protection, if you will. It's we're not allowed to call it healthcare, right? But it's called health sharing. And I want to jump into this because this is amazing. We'll probably save your family lots and lots and lots of money and give you the same protections insurance companies do, but probably at a happier rate because it's a whole community. A little bit about Tiffany. She's based out in Boise, Idaho area. Passionate about helping business owners discover a modern and affordable alternative to health insurance, wherein most save between 30 and 50% upon joining. And while Impact Health Sharing functions similarly to traditional healthcare plans in some ways, it really stands out in the ways that matter the most and support the people that they need to support. So welcome to the show, Tiffany. I'm so glad that you're here.
Thank you so much, Lorianne, for having me. I am pumped and excited to chat with you about Impact.
Oh yeah, when I heard about this, I was so excited about it. I met a mutual friend of ours, Monty, and he was telling me about it. I'm like, oh my God, this is incredible, and this is what we need. We need alternatives to the high cost of healthcare. So let's just start out. What is Impact Health Sharing?
Yes, so Impact Health Sharing is an alternative to the traditional sense of healthcare insurance. So the concept of healthcare sharing is nothing new. It's been around for 40 years. In fact, I didn't know this before I heard of Impact, but it's been around. And what makes Impact different, though, is that it has a technology backing it. So it's the most modern and contemporary version of healthcare sharing that we have here in the United States of America. And one thing about Impact is that it will feel like traditional insurance in the sense that, hey, we have our own Impact card that we can show to providers, go to any doctor, but it has the non-for-profit approach of healthcare sharing, aka saving in cost, and they save us in our medical bills, which are one of the leading causes of debt here in the United States.
Yeah, unbelievably so. The other thing about the sharing is it's been around for a long time. A lot of
Yeah.
people know it. It used to be religious based, and it is not. ACN is not religious based whatsoever. So now they've really expanded, and ACN's been around how long? It's like 20, 30 years, something like that.
Yes. So ACN is the marketing arm for Impact. They have the exclusive marketing rights. Impact is separate, of course, as the company itself that's providing the service. We are the marketing arm to push Impact nationwide and to be able to get families and businesses savings.
Yeah. So now let's be very clear because you keep calling it sharing. Is this a health insurance?
No, it is not. It is an alternative to health insurance.
So let's talk about that. What does that mean, an alternative? And really, really, let's dive deep into the weeds on this.
Yeah, no, that's a great question. So what this means is you're opting in to share into medical bills of all the members that are a part of Impact. So you're opting in, it's not insurance, aka they're saying, hey, we're not promising that we're going to pay these bills, but just so you know, all of the bills have been paid in time. So none of our members have ever gone into collections, but it's a way to opt into this pool of money to say, hey, let's share into each other's bills. Let's offset the cost of healthcare. So the way that it works is you go to a doctor. Let's give you an example. I had a car accident. I went to the hospital. I gave them my Impact card. I was seen. 4 hours later, I was discharged. A couple of weeks later, I got a couple of medical bills, one of them being $12,339. Okay, that's one medical bill.
From the hospital.
From the hospital. Just 4 CT scans, that's it. Barely spoke to my doctor. And what Impact will do is they will reprice the medical bills. So my medical bill from $12,339 and went to $1,534. So $1,534. That's 80% in savings, okay? So that's huge. They will reprice it. So that's how it works, right? They're repricing bills. You're opting into the service.
Right.
Does that make sense?
It does, but you're using this term repricing. So
Yeah.
what do they do? Do they call up the hospital and say, dudes, this bill is ridiculous?
No, I
No.
love that question. That's a great one. So what they're doing is they're actually doing research. So they're backing it up by research that's localized and also by the codes. So this is why when you become a member Impact, they ask for an itemized bill so that way they can look into what it should cost. So you'll get the itemized bill, you're provided to Impact through your portal, which everyone has access to, and
Great.
Impact will do the research and say, hey, this is what it should cost, and this is how much it's been inflated by. So they're going to make sure that we're not being inflated in pricing, which it does happen, unfortunately.
Yeah, so if I'm on an insurance policy, they're paying these crazy prices, but they do what's called a contract agreed upon price.
Correct.
So this is almost like the contract agreed upon price, but they're looking at what the cost should look like in your area, in your state, for that particular service. Yeah? Am I
Correct. And one thing
getting
about Impact is that there's no network. So you can use I can use Impact here in Boise, Idaho, just as easy I can use Impact in Georgia when I'm visiting family, as well as in Florida. So there will not be any changes there.
right?
And there's no contracts, but some providers do choose to opt in and become a part of the network, even though we don't have one. But yes, they'll make sure that we're not being charged inflated prices. And on average, we're seeing savings of 72%.
Wow, that's great.
Yes.
So how is this different from insurance? Let's really, let's jump into that. It's like what differentiates this from insurance? Because again, we're trying to wrap our head around it. Our listeners are sitting there going, "What now?" I have an insurance plan. It's not really covering anything. I jump into Impact. I have a health insurance card. I can go to any doctor I want. I don't have to choose a doctor in network, out of network, because there is no network. Correct me if
Mhm.
I'm wrong right now. So as I
Correct.
understand it, and I then get the bill. And then once I get the bill, I put it up onto the portal of Impact, and then they take it from there.
That's one way. However, remember how I mentioned earlier how Impact has the technology backing? We
Yeah.
also went ahead and invested into what is known as an EDI payer ID, and this is the back in the back of the card. What this means is that doctor, that provider can actually bill Impact directly. So that's where it feels like traditional insurance. So no longer do you have to, wait for the bill to be given to you and pay up front and wait to get reimbursed. No, now the provider can bill Impact directly. So that's what makes it unique in that sense. So that's one of the options, right? You can wait for your bill to arrive, you can submit it to Impact, they will reprice it, and then you pay the repriced amount. Or the provider can go ahead and pay, send the bill directly to Impact, they'll reprice it, and then you make the payment. So there's multiple ways to go about it there. It just depends on what that provider's preference is. Because even though we have an open network, it also depends on whether the provider is going to be willing to, work with Impact, or if they just want you to, get the bill yourself and then submit it that way.
Gotcha. Now, I can't help myself. I'm a coach, so I'm very, very curious. So I'm looking for the pitfalls, right? And
Yeah.
I'm sitting here going, wait a minute. So now you get into an accident and I have to pay your bill?
You mean like the members?
Yeah, yeah.
Oh,
So
okay, perfect.
you're a member, you get into an accident and you said, the membership puts in a pot of money. I actually liken it to, have you ever played left, right, center, that game where you do a dollar to the right. If you get that, you throw dice. And if it says an L, you give a dollar to the left. And if it
Mhm.
says R, you do a dollar to the right. And center is the center pot. And that's like almost the pot that everybody gets at the end, whoever wins. Anybody who has the money at the end gets that pot in the center. So I feel like the impact fee, whatever that membership is, it goes into the pot, and then you pay the bills out of that pot. Is that a good way to explain it?
By the way, I want to play that game.
Oh
That
my God,
sounds
it's so much
great.
fun. You got to do the left, right, center wild card, because wild card allows you to steal somebody's dollar around the table. So if somebody's really getting a lot of dollars and you get the wild card, you go and you get the money from them. You're like, give me a duck, give me a buck.
Yeah, I
So
have a new game I'm gonna play.
a lot of fun on Amazon. Go for it. I don't get commission. Go ahead.
Okay, so yes, so one of the things that I mentioned earlier, how Impact feels like traditional insurance, but it has a not-for-profit approach. So one of the things that we have, and by the way, because it's healthcare sharing, we have different terminology, but it has a similarity in function. So for example, we have a primary responsibility amount, which is synonymous with deductible. So here, every member, when they come in, they can pick whichever deductible they want to be a part of. So whether it's the $2,500 one, the $5,000 one, the $7,500, or the $10,000 one, that will determine how much you pay per month. And it's also determined by how many members are going to be covered under your household. So we look at the birth of the oldest person. and how many members they have, and then that will determine how much they're paying per month. So you're going to use your regular doctor. You may use it for emergencies. Once you meet your deductible, then it goes into the sharing, which, by the way, it's 90% of the members will cover 90%, and then you as a member are responsible for 10%. And here's the best beautiful part, which I love the most, is that there's a cap of that 10% that you're responsible for the year, and that's $10,000. Sorry, not 10,000, $5,000. So let's say, just give you an example myself. I am 30 years old. I'm paying $246 a month. I pick the $2,500 deductible. And once I meet that, then it goes into the sharing. Whatever other bills has, Impact will reprice. I pay 10% up to $5,000. So to say it simply, $7,500 is the most that I'm looking at, no matter what. If it's colon cancer for that year, and I'm covered, and it's comprehensive.
Wow. That's very interesting. Now, the higher deductible, and let's just say I have a family of four, is it, let's just say I said I took the 10,000 because it's going to, the contribution will be less, right? Is it 10,000 each member, or is it 10,000 collective for the family of four?
No, ma'am. So it is 10,000 collectively, and that's where the non-for-profit approach of Impact can be helpful for those who have a lot of family members. Yes, ma'am. And here's the beautiful part. So when you're determining how many members are
Call
in that
me
household,
ma'am. Oh my gosh.
I call everyone ma'am, even my
I know it's so polite. I'm down south right
I'm a
now.
Southern girl.
Yeah, Southern girl, Southern guys. They're like, yes, ma'am, no, ma'am. I was like, wait, no. I'm only joking. I'm just joking. I was just, did
Oh
she
man,
just call
the
me
Savannah,
ma'am?
Georgia is still in me. It's still in me, even though I live in Boise, Idaho.
It's all good. It's all good. I knew because I heard a little drawl there. Not,
Yeah, it's
but a
still
little
there.
bit. Yeah. I'm sorry. I didn't mean to interrupt, but I was just like, wait a minute. I had a little moment. So back to what you were saying, the deductible is collective for,
Collective, yes, yes. And one of
yeah.
the things I want to point out too, now that you bring that up, is when we're determining that monthly cost, when you're looking at the family members, it's based on 1, 2, 3, and plus. So whether you have 3 family members or 7 or 9, which we have seen, it's going to be the same as if you had 3. So that's huge.
Wow, it is huge. And I also understand that as you take the higher end deductible, your monthly is lower.
Correct.
Yeah.
Yes, exactly. That's exactly
Yeah.
how it works. And I usually tell people, hey, what are you comfortable with if you were to have an emergency? The worst case scenario, do you have this in your bank account or somewhere to where you have access to it? Right? That's usually what I like to paint the picture, because the last thing you want is to pick something that's, the cheapest, but let's say you don't have that available to you. Mind you, it works just like traditional insurance in that sense. So you want to make sure you have that amount ready and available should the worst case scenario happen, and then it goes into the sharing.
Right. So say that again. Because if I have it ready and available, why do I need the plan?
Well, I mean, right. So who's going to reprice your medical bills, right? So, for example, my medical bill of $12,339. Yes, I may have that in my bank account, but I much would rather pay that $1,534 versus the $12,339. So
Well,
it's that.
the
Yeah.
1534, you're only paying 10% of it, right? The fair.
No, that was even before I met my PRA, my deductible. So that's one thing that's special about Impact is, yes, they'll reprice your medical bills even before you meet your deductible. So that always happens no matter what. Then you pay what you're responsible for until you meet that deductible, that PRA, which is what we call it, and then it goes into the sharing for anything, anything that pops up after that.
For 90% or more, which is more than most insurance plans is 80/20 usually. So
Exactly.
you're going to be responsible after the deductible for 10% of whatever that
Correct.
bill
Up
is.
to a max of $5,000.
Yeah. So Tiffany, I'm having a hard time wrapping my head around this. Happened to me. I went to the emergency room. I
Mhm.
wasn't feeling well, ended up having kidney stones. Long story.
Those are the
Um,
worst. Yeah.
oh my gosh. But I went to the emergency room and it was $14,000.
Oh yeah.
$14,000. And then because they didn't do one of the tests they should have, I got sent back to the emergency room to do the test, and it was $17,000.
Oh man.
And when you say that they took your 12,000 and change and brought it down to 1,500, it makes my mind explode as what's going on. Are the hospitals or the doctors or the taking advantage of these systems, or like how do I protect myself as an individual?
Right. And it's so unfortunate to hear that. And before my experience, I've heard of it, but I just never knew that this could happen. But I mean, 4 hours in the emergency room, and here I am with the big bill. Unfortunately, the healthcare industry is broken. I hate to say it, but it is the truth. We're seeing it. A lot of people are going into debt because of medical bills. To be honest, I
Look at
wouldn't
that. If
be
I
able
didn't
to.
I don't mean to interrupt, but if I didn't have insurance, and I'm blessed and grateful that
Yeah.
I have insurance, so that was, it was $100 for me. But
Oh,
but
amazing.
the whole, yeah, but the whole point but what if? What if somebody
What if?
doesn't have insurance and they end up doing the same thing? Like, there's
Exactly.
nobody there negotiating it down. There's nobody there
On your behalf.
protecting you. There's
Exactly.
nobody. So if you don't have insurance available, it sounds to me like this is a really extraordinary option.
Oh, absolutely. I mean, even in the traditional, I mean, with your insurance, it's great that they were able to reprice it. You said to $100, was it?
Yeah, it was $100 deductible. Yeah.
That's insane. That's amazing. But there are, I've heard of examples where they have traditional insurance and they're still left with hundreds of thousands of dollars that they have to figure out. Somehow they have to sell a house or something, right? So
Yeah.
it just depends on what insurance you have. But I would say, honestly, I do not recommend anyone not to have insurance. I'm considered healthy traditionally, right? But look what happened. I broke my foot playing volleyball. That was one accident. And then I was in a car accident back to back, basically. So now I see how crazy this can get and how inflated the prices, the bills can be. I honestly, my heart goes out for anyone who doesn't have insurance or an alternative like Impact. But honestly, we're looking at 30 to 50% in savings for those who consider Impact compared to the traditional healthcare industry. So it's worth taking a look at the very least, right? Having some sort of coverage is better than none, especially if you're looking at a bill that's $10,000, $20,000, 60. I mean, we've seen insane bills out there, and it's always nice to have someone who's going to advocate for you and truly knows what it should cost, right? They're going to look at the codes, they're going to make sure that it is what it should be.
Right, right. So again, let's play my what if game. It's
Yeah,
nasty again.
absolutely. I love it. I love
But
games.
the what if game is so here's the question.
Mhm.
What if that pot of money in the center from all the members, what if they run out of money? Have they ever run out of money where they can't pay those bills? And then am I on the hook as one of the members?
No, ma'am. So there is a cap, and I get this question a lot. So I'm happy you asked this so that way other people can hear of this. There is a $500,000 cap for the period of that year. So it's not from January to December. It's whenever you signed up, which by the way, we have open enrollment year round. So that's beautiful. From whenever you signed up to the next year on that date. So there is
Okay.
a cap around $500,000. And by the way, like I said, they're going to reprice the medical bills. I have yet to see any bill to be still, after it's been repriced at $500,000. So we have not had any members get to that point. We're going to reprice it. And there is that cap to ensure that we're not going to run out of money. Not only that, but to be considered healthy in the healthcare sharing space, you want to have at least 3 to 4 months of reserves. We have over a year in reserves. So we're doing great when it comes to finances, so much so that we're actually rolling out programs to basically put the money back into the members. It's not for profit, so it doesn't go to the CEOs or anything like that, right? And so let me just share one thing because I'm really excited about this, is we had a program that we rolled out back in July, in that last year, of course, where they're rewarding you for taking care of your health, Lorianne. So let's say if you go to the gym, if you take beef liver supplements like myself, or let's say you get a massage, you go to a naturopath. I mean, the list goes on. If you do that for your health every month, you submit the receipt to Impact, up to $150 will go towards chipping away at that PRA, that deductible that you select. How amazing is that?
Wow. Wow. And don't they reimburse? Don't they
No, they do not reimburse you unless you've already met your deductible.
PRA?
But they're
Okay.
reimbursing you for like the medical bills, not for this health and wholeness program.
Do they have something like an FSA or an HSA
I
where
wish, I wish I asked this. If you already have a standing HSA when you sign up for Impact, you can use the remainder in balance, but you can't contribute more to it.
Gotcha. Yeah, no, this is amazing that it's a really good alternative, especially if you don't have any insurance. I don't
Mhm.
recommend anybody not have insurance because healthcare costs are
Through the
horrific.
roof.
So the $500,000 in your year, your 12-month period, it's not 500,000 a bill, it's 500,000 collectively total by individual in the household or collectively in the household?
Individual, correct. Yes, ma'am.
Individual. And then what happens after the 500,000?
What do you mean? Like once
So
they
let's say I got $1 million bill because I have a very terminal illness. What
Mhm.
happens?
Like I said, they're going to reprice that bill. And I have yet to see, just as far as I've been able to share this with families and business owners, we have yet to see to where it stays at that $500,000 mark. It's always repriced. I mean, kid you not, there was one bill that I saw that was around the $200,000 mark. This is a realtor out in Texas, and her bill was repriced down to like around $6,000. So again, they're huge. I mean, yeah, exactly, right? My jaw dropped too
I
when
have
I
a
heard this
perplexed, for
story.
those who are listening, I have a perplexed look on my face, like, what?
Yes,
Are you
it's insane
serious?
how inflated the medical bills are. But again, we have yet to see any members even get close to $500,000. But again, even if they were, we have the reserves in place. We even have a program with an Impact for those who do not have the finances. They can apply to a program where Impact is going to jump in and help out if they're able to, depending on what the circumstances are. And it's called Extra Impact. They even sell a sauce to be able to fund that program. So again, we're member centric and we truly want to disrupt the healthcare space for the better.
Oh my goodness. So good. Oh, Tiffany, I have a plethora of questions for you, but we have to go take a break. We're going to take a short break. You're listening to Healthy Lifestyle with Lorianne. We'll be right back. Welcome back to Healthy Lifestyle with Lorianne. I am Coach Lorianne. If you'd like to be a guest or lift up your business, product, or not-for-profit, if you have questions or concerns or a comment, we would love to hear from you. Please email us at healthylifestylewithla@gmail.com. We really, truly appreciate it when you send those questions in and suggestions. We've had people on, guests on, as a result of your email. So please keep sending them in. We love to hear from you. Back here with Tiffany from ACN, from Impact, talking about healthcare and taking care of ourselves, which is, healthy lifestyle. So this is really an exciting alternative that you're putting out here. And I love this company. The company is US based, right? Somewhere in the Carolinas.
Yeah, Florida, actually. That's where it was. It is offered nationwide. There are only a certain few states that are currently don't have Impact, which is New Jersey, Rhode Island, and Washington. But we're currently working on that, so hopefully we'll be nationwide soon enough. But yeah.
That sounds great. So we left off that, you've never seen anybody go over the $500,000 12-month cap. And you've had critical people who had terminal illnesses, unfortunately, and things like that. It's just so sad. But so what happens when a major event happens and I end up in the hospital for 7 days and hating the food, not loving being there? What happens? What happens in those cases?
Yeah, so again, it's just like traditional insurance. So in the sense that you just provide them your card and you get your treatments, right? You make sure that you're taken care of. Once you're done, hopefully the provider will bill Impact directly, so that way it's less work for you. But let's say that they don't do that, then what will happen is they're going to mail the bills out to you as per usual. And you're going to make sure that it needs to have the codes, so that way Impact can make sure that it's priced correctly. If not, it's as simple as going back to where you were treated, getting that medical bill, giving it to Impact in the portal, and then let them take care of the repricing. That'll take some time, maybe 1 to 2 weeks is what I've seen, at least for my personal experience with the car accident. They'll reprice it. You'll see it in your portal. This is the fun part, okay? When you become an Impact member, you get to log into your portal and see where bills are at in the process as they're being processed to when they're completed. So
Wow.
you get to be a part of the transparency and see what's going on, right? So I logged in, I saw, hey, my bill has been repriced. It was from $12,339 to $1,534. I saw, hey, this is what I'm responsible for. And now I know, now I can go and pay this provider this amount. So you do that.
And you pay them directly. So a lot of times, at least I found in New York, they would be billing Impact, but they also are billing me. So by having that portal, I can look at where it is and I could just say, all right, they clearly have it, or you may not have it. So that tells me I need to load it up into the system, right? So am I getting this right?
Yeah, exactly. No longer do you not, you can, yes, of course you can call them and ask, but now you have the transparency to where you can see for yourself what's going on. It gives you more power in your hands to know exactly what you need to do next.
Yeah, because most people, they're coming home from work, it's 4 or 5 o'clock at night. They can't make that phone call, and now they have agita all night. Oh, that's Italian for like a nervous stomach.
Yeah.
So they're gonna have agita all night, and they're gonna worry, and there's unnecessary. You can jump right on your computer and see where it is. Did I have
Exactly.
it? Did I not? What do I have to do? And you just go to like, what department would I go to for my service provider? Like if it's a hospital, I go to billing or something.
Yeah, billing's the easiest one. Just say, hey, I would like an itemized bill of my procedure or my
Yeah.
my appointment. And that should be as simple as them printing it out, giving it to you, and then you can upload it to the portal. So it's very simple. Impact doesn't like to complicate things, but that's what they need to be able to make sure that the pricing is correct.
Gotcha, gotcha. So tell me some beautiful stories, like your best favorite stories about being part of Impact and helping other people be part of Impact.
Yeah, I mean, of course, I have my own, so I'm always grateful to know that I had impact. So that's one of them. The other one is that realtor that we heard of that was in Texas. I mean, she was traditionally, and by the way, I don't know if I mentioned this, but Impact, one of the reasons why we're able to keep costs so low is that it's traditionally geared towards those who are considered healthy, who just want to have, something they can go to every year to get a checkup, need have it for emergencies, but you don't want to be someone who has a lot of pre-existing conditions because that's something that we do look into. We won't deny you, but we're gonna dive deeper to make sure it's still a good fit for you.
Yeah.
So I do want to mention that and lay it out for everyone so that way you know. But this realtor, she was considered healthy by traditional standpoint, never knew that she would need healthcare. She was in the hope and pray plan, as some of us call it. And lo and behold, she
In
ended
the
up
what? You talk New York fast like me. She was in the what plan?
I get so excited. And the hope and pray plan.
Hope and pray. Okay.
Yeah, like you hope and pray that nothing happens, right?
Yes.
Um, and so, yep, she got cancer out of nowhere. She had no idea that this would happen. And, family members and friends were telling her, hey, you're going to have to start selling things, selling houses, selling investments, just get ready for it. Maybe start a GoFundMe. And Impact, like I said, was able to reprice it down to around $6,000. So, I mean, incredible savings. There's been NICU babies, there's been a guy that was hospitalized for 7 days after having a fall from the roof. And his bill was astronomical. I mean, astronomical, and the hundreds of thousands of dollars. And then he was only responsible for around 5,000. So, I mean, it's just story after story, of Impact truly stepping up for family members. And my personal favorites are those who, let's say that they just don't have the funds and they need the help. And then there's that extra impact where Impact will step in the community, through all the sellings of that sauce to be able to help out and truly help a family in need. There's been one last more that I want to share. It's not like specific, but it's something that shows the advocacy that Impact has. Is there are some times where you will go to a doctor's visit and you need a surgery, and they do not want to take care of you until you do like a big down payment, basically. Like for example, $10,000 to get your child's ear surgery done. I've heard of that. And what Impact will
What?
do,
Yeah, they take a like a retainer before they do
like,
the
yeah, they
work.
want you to meet your deductible essentially, depending on which one you select. So let's say if you pick the
Wow.
$10,000 one, you have to pay that up front before you even get to be seen. And we've seen that happen. And Impact will actually step up and go ahead and pay that out. The community will, to be able to get that, that member to be able to be seen. So there's just little stories like that that truly, I mean, it shows the advocacy and the member centricness that we have here at Impact.
Yeah. How does that work? If it doesn't cost that much and then they negotiate it down, do they get paid that money back from the doctor, hospital, or whatever the provider is?
Does who get the money back? What do you mean? Sorry.
The impact. Does impact get that back after they laid out the $10,000 if it was the $10,000 deductible? Would
That's a
they?
great question. Yeah,
Yeah.
I don't want to steer anyone in the wrong direction because that's beyond my department. I've just heard of the story, so that's as
Yeah,
far as
yeah.
I
Yeah,
know. I don't
yeah,
know the
just
back inside. Yeah.
wondering how that works, because if they're taking the
Yeah.
liability and the risk, but I'm sure they probably figure that out too because
Oh yeah.
of the fact that they're constantly in there advocating. And so I go into my doctors. I just want to really get some clarity here. I go
Yeah.
into my doctor of choice that I've been going to for 5 years,
Mhm.
and they're like, "Yeah, we don't take that."
Mhm.
What happens now?
Okay, so the very simple answer to that is you can look at your card and have them reach out to the number on the back of your card. And we have a whole department that will, just focus on educating providers and saying, hey, we're Impact Health Sharing, by the way. Here's how we pay on time. Here's how we pay above Medicare rates. So they're going to educate them on all the things that providers actually care about and want to know.
Yeah.
And for the most part, providers at that point are happy to take it because they know they're going to get paid on time. That's huge. But let's say that they still are kind of hesitant. Maybe they've had a bad experience with the different healthcare sharing, or just don't know how it works at all, and they're just not comfortable. We can still do the version where they give you the bill or they mail you the bill, and you can submit it to Impact and have them reprice it, and then you can pay the bill. So it just depends on what they're comfortable with. But we do have a department that will work on educating them.
Will I be turned away from getting my services done that day?
From the provider?
From the doctor, yeah. From
It
the
depends on your
provider.
provider, right? So we can't, unfortunately, we can't force their hand and say, hey, we're going to pay you,
Do
please.
it anyway.
Right? Do it anyway, right? So it really just depends on the provider. But again, what we like to recommend is actually, hey, book your appointment ahead of time. Let us know when you book it. We have a portal and a section where you can submit that and say, hey, I booked it for this day at this place. Here's our phone number. Give them a call, and they'll go ahead and call them, and they'll let you know, hey, this is how it went. So we do have that set in place as well for those who want to be able to know ahead of time.
I love it. So you mentioned Medicare, which of course I have a flurry of questions on that. So we have more mature members, right? And we have to take the Medicare. If somebody's on Medicare, do they get to go into Impact? Can they do Impact too?
Yes, but it would be secondary to whatever they have, right? So usually Medicare is Part A and B at the very least, and then Impact can be secondary to where it will come in and pay and offset whatever Medicare did not cover. But you do have to have that in place.
So you have to have Medicare Part A and B.
At the
Um,
very least, yeah. But of course, there are other parts that you might want to have, of course. But Impact is just secondary to come in and offset the cost. For seniors, there is a $1,000 PRA deductible. And it doesn't matter if you have any pre-existing conditions. That is one thing that they do not take into account whatsoever. So you can go in there with as many as you may have. There is that $1,000 deductible PRA. And then it just supplements whatever Medicare did not cover.
So
Mhm.
speaking of seniors and pre-existing conditions. Now, there you had mentioned something earlier about pre-existing conditions. What if I have one? Like, how does that work? If let's say I have a pre-existing condition, but because I'm getting such great care because I'm on Impact, now I don't
Mhm.
have it anymore. What happens? Does anything
I
happen?
love that question. So, pre-existing condition, by impact definition, is anything that has been diagnosed or treated within the past 36 months. So, anything, again, diagnosed or treated within the past 36 months, going forth beyond that date, if you're past the 36-month mark and nothing has been diagnosed or treated anymore, then you're no longer considered pre-existing condition. Now,
Okay.
if you do have a pre-existing condition, this is when it's important when you're considering impact to let us ask you the right questions to make sure that it's going to be a good fit for you, right? Because for some pre-existing conditions, it's just as simple as a medication that you take every month. And by the way, in our portal, you can actually see how much medications will cost depending on which pharmacy you go into. So that's another sense of transparency that we have in place. Um,
Oh, that's great.
it's huge. I use it a lot.
I have another question you can't answer. But the question is why would that same medication be a different cost depending on which pharmacy you go to? I'm sorry, I'm just complaining
No,
today.
it's a great
Um,
question, and I have it too. I have no idea why, but
right.
I mean, it's also, I mean, it happens with regular groceries, right? Here in Idaho, we have Fred Meyer's and Albertsons, which is the more, fancy, but for some reason,
Fancy.
they're different in pricings for the same groceries. So
Yeah.
unfortunately, it's just a thing. But hey, at least here we have the transparency to choose where you want to put your money at, right? And how much money you want to save. So,
Yeah.
but yeah, back to the pre-existing.
Yep,
Sorry,
yep.
you have a question. I saw your
No,
face.
no, go ahead. Pre-existing.
Oh,
I'll ask my
so
next question.
okay, yeah. So, I mean, basically, it's just a matter of, hey, is it just a medication? And can we save you money on that medication? If so, hey, it might be a great fit for you. Or, hey, are you going through cancer treatments? That's expensive, right? You may not want to switch over because it may not be the best fit. We'll still reprice the bills. That will always happen no matter what, whether you've met your deductible or PRA or if not. But the medical bills will not be shared into. So that's where you want to really stop and pause and see whether it's going to be a good fit for you or not.
Yeah, yeah, that makes a lot of sense. So you cover medication? Do you have dental and vision and things like all that yumminess?
And by the way, the medication is not like per se covered. It's just a matter of having access to savings, kind of like a good RX Gold.
Yeah. Yeah, yeah.
Basically, that's what that is. And then what was the next question you had?
It's like a good coupon because those cards are
Yes,
coupons, you know. It's like, oh,
exactly.
you're not paying $9,000 for this medication that you need to survive. You'll pay
Mhm.
that. I'm like, what?
Exactly.
Yeah. No, vision and dental. Do you have
Oh,
that?
yes. Yes, that's a great question. So we have, it's similar to the prescription where we have a savings plan or a savings card. So for dental and vision now we have that. So what it is you log into your portal and you can see, hey, this is how much it would cost to get this, X, Y, and Z. And you can go to the for those, they do have preferred providers because they already have contracted pricing done. But at least you know, hey, this is what it will cost me. I can save money if I go here, and that's how it works.
Okay. Is there maximums, annual maximums on those as well?
Not that I'm aware of, because mainly you're just seeing what, each procedure you want to do, and then you just take whatever it's repriced to. But that's a great question. So I will definitely look into that one and to double check.
Yeah, I just wondering if they're, if they're so because if you go on any of the dental plans, there's always like, oh, you can, up to $2,000. I was like, okay, that's one, two, three.
Right. And because this is not considered a dental insurance, it's more of a savings plan, a savings card to be more exact. I mean, you're just picking and choosing like a buffet on what you want to get done, and you're getting your savings up front, right? You're seeing what you're going to pay. So that's why off the top of my head, I don't think we have a maximum, or because it's just you pick what you want to get done, and then you already have the savings done. So
Right. Right.
yep,
So instead of having a $2,000 extraction, it might be a couple $100. So
correct.
don't quote me on that because I don't know what the prices
Don't
are.
quote me on it
Just
either.
an example, just in case. I don't want to get emails about that. I love your other emails, but not those. So we want to be very accurate, especially when we're talking about things like this. So first question I have now is about you. What got you into Impact?
Yes, so I have been a 1099 self-employed gal ever since I graduated from university. So always had that heart for just that entrepreneur spirit, figuring it out. And it actually started through real estate, and it stayed through real estate for the most part. And one of the things is a lot of realtors, in fact, 6 out of 10 of us don't have healthcare. I had healthcare, thank goodness, but I was paying, I wouldn't say something I was happy with, right? And unfortunately, because our income fluctuates, I would use the tax credits and then I would owe money income tax season. So it was just a big headache to say the least. And my broker in Georgia told me, "Hey, check out Impact. You're healthy. It might be a good fit." And I did. I met Monty. That's how we
Oh,
you
okay.
met Lorianne. Yep,
Yeah.
there he is in the story. Met Monty, and it just made sense on a basic level. I'm like, hey, I can get comprehensive coverage. I can save a little bit a monthly. And now I know if something major happens, then at least my deductibles back then were insane, let alone out of network. Oh my goodness, it was scary stuff. So now
Yeah.
I knew, hey, worst case scenario, if I have this money in my bank account, I'm going to be okay. So it
Yeah.
just made sense on a basic level. Like I shared earlier, I got to use it, breaking my foot playing volleyball, and then that car accident. Not fun, not fun. But I got
Mhm.
to use it, and at that point I realized I have a gift in my hands. Let me start sharing it with more people, because it would be a crime not to share, right? When you know you can help someone, at the very least open your mouth and then let the
Yeah.
rest take care of itself from there.
Well, I know so many people who don't have insurance, and a lot of them are in their 20s and 30s, and it terrifies me that they don't have it. Again, I'm very blessed. I do have insurance, but there are so many people out there that don't, and they're playing, the Russian roulette game. It's just like we don't know. What did you call that? There was another plan that
The
you
hope and pray plan.
Hope and pray plan. Yeah, so they're on the hope and pray plan, and I was like, yeah, you can't do that. And then they're also getting to the age where they're getting married or they have partners, and then they want children, and then there's a lot of costs when it comes to something like that. So,
Oh
so
yeah.
I found this amazing when I was talking to Monty. I was like, this is truly an amazing gift, like you said, that is available to us, and I just wanted to scream it from the the rooftops about it, and that's why I have you on, and I'd love to have you on again, just to dive a little bit deeper. But in order for someone to do this, like how would, if I'm sitting here going, yes, I want to know, please tell me, how do I get this? How, and I want to put the information with the episode, like how do I reach out to you, or who do I reach out to? How do I get more information about this if I'm interested in impact?
Yeah, so the easiest way is just to give me a call, honestly. I like to keep it simple. I don't know if you want me to give you my number or if I
Sure.
should. Oh,
Yeah,
so
you can say it right on air.
oh, fun. Okay, so everyone, here it is. 912-332-8541. And my name is Tiffany Roggia. I'll be happy to go over any questions and we can dive deep to make sure it's a good fit. Because that's the most important part. You don't want to sign up for something going in blind, right? You want to make sure that it's going to be a good fit. So I'm going to ask you the right questions and then we can assess whether it's going to be a good fit for you.
Yeah, and it doesn't, it doesn't hurt to explore anything. I know a friend of mine who also is doing what you're doing, is sharing the information with other people. Right off the get-go, she saved $900 a month.
Oh, yeah.
$900 a month. And I was just like, whoo-wee. So, and then anybody that I know, my son and his friends and stuff like that, if they don't have health insurance, I'm like, you need to check it out. And that's all I only say is because you need to check it out, because it
Mhm.
may not be a good fit, but in most
Exactly.
cases, it is a good fit.
Oh,
And
yeah.
I think it'll grow with you too. So your number is 912-332-8541.
That's
Um,
right.
Yep. Give Tiffany a call. Let her know that you have some kind of interest. She'll take you through everything. Maybe if you ask her, she'll speak a little slower. But if you have other questions that I didn't ask, I would really reach out. Is there an email they can reach out to that you're thinking of, or would you
Yeah,
just prefer the call?
super simple. So impact with Tiffany, and that's Tiffany at gmail.com.
Beautiful. So, and I'll include it with the, as you can see, I was writing down. I'll include it with this episode so that we have it with it, and they can get in touch with you. So if you didn't write it down, it's impactwithtiffany at gmail.com. If you don't get it, don't worry about it. Look it up. It'll be on all the major podcast platforms. It will be with iHeartRadio and of course on YouTube. So jump in there, visit me at Healthy Lifestyle with Lorianne, and you'll be able to get all this information with this, because you probably want to listen to it a few times because we both speak New York fast. I should have told everybody you need to put your seatbelt on because we're going to speak quickly. You should have been, I can't believe you're from Georgia, because you speak really New York fast, and I love it because it's your passion, right? Because that's what happens to me. I get excited about something and I start talking really, really quickly. And I've been a speaker for a long time, and at the beginning, they'd be like, I got half of what you said. So you learn to speak a little slower, but there's nothing wrong with that passion, and I love it. I think it's great. And you have so much good information. I love it. Thank you so much for being with us today, Tiffany. I really appreciate you. I love what you're doing. I love that you're sharing this with everybody. And I hope you guys are smart and you reach out, get more information about Impact with Tiffany, and we will see you next time. Thank you for being on, Tiffany.
Thank you, Lorianne. I had a blast. Love, love, love chatting with you. Thank you, everyone, for listening.
Beautiful. And thank you all for joining us today on Healthy Lifestyle with Lorianne. I hope we earned the privilege of your time. Again, I want to thank our guest today, Tiffany. She is from Impact. It's a really good health sharing program. Really check it out. Look for our show next Saturday, of course, at 3 p.m. on JVC Broadcasting and iHeartRadio. And we can, of course, be found on all major platforms, and would be so grateful if you please like, follow, share, and subscribe. Until next time, I am Coach Lorianne, America's #1 Take Action Success Coach and Strategist. Let your dreams be bigger than your fears, and let your life be filled with joy. We'll see you next week. Have a great day. Bye.
Bye.